We in WHO are outraged at the alarming frequency of attacks on health workers and health facilities in several countries of this region. There are international laws and conventions calling for their protection, yet these are not being complied with. Our message is clear: stop targeting health workers and stop bombing health facilities. Working under extreme pressure to save lives with limited supplies and limited resources, the challenges faced by health workers and patients in conflict settings are many. Being a target should not be one of them. Yet in a number of countries across our region, health workers and health facilities are targeted with alarming frequency. Health workers are assaulted, kidnapped, and killed. Health facilities are damaged or destroyed. And in some cases, health facilities are taken over for non-medical purposes. Ambulances are looted, stolen, shot at, and denied travel through checkpoints. Patients face enormous barriers in accessing healthcare or are denied even the possibility to do so. Threats to health workers, patients, and facilities also take place through the intentional withholding of medicines and treatment to besieged populations and through deliberate interruptions to water and power supplies, reducing the functionality of health facilities. These incidents remind us of the enormous difficulties and dangers that health workers face every day. In continuing their work to provide health care, they deserve more than our admiration. They deserve greater protection. When health workers and health facilities are targeted, populations that are already vulnerable are further deprived of what little access they have to medical care. Thousands of people die every year, not as a direct result of the violence, but because the environment has become too dangerous for health services to be delivered. And as international relief organizations, there is only so much we can do in conflict settings if these attacks continue. A significant number of people requiring health care live in areas that we are unable to access. And in these contexts, health workers that provide care must be allowed to function without additional threats to their lives. Let's remember that protecting healthcare workers is one of the most pressing responsibilities of the international community. And in this respect, the landmark resolution on healthcare in armed conflicts, unanimously adopted by the United Nations Security Council on the 3rd of May of this year, serves as an important step in highlighting the urgency of this issue and the need for immediate and effective action. Health is a human right that must be made available to those who need it, regardless of political affiliation or geographic location. The integrity and neutrality of health must be safeguarded for all.